Hi there. I want to talk to you today about my prostate cancer diagnosis and the journey that I went on last year, which ultimately led to me having my prostate removed. My name is Ian White. I'm the General and Commercial Manager for the Northwest of England. Back in February 2025, my wife was listening to a radio programme on BBC Radio 2, and there was a discussion taking place around the increase in the levels of prostate cancer rates, particularly in the northwest of England. As a result of that, she asked me if I'd ever been tested, and I suppose in typical male fashion, I answered, well, why would I need testing? Because I haven't got anything wrong with me. I've no symptoms or anything that would suggest I've got any issues. But she reiterated that part of the discussion she'd heard that men don't always get symptoms for prostate cancer. And so she encouraged me to go to the doctors and ask for a PSA test. So I subsequently went to the doctor, asked for the PSA test, which is basically, he referred me to the hospital for a simple blood test. There was no intrusive examination as you'd normally hear of for this kind of test. So I went to the hospital, had the blood test, and within 10 working days, the results came back. I was called back in to see the doctor, and he informed me that my PSA level was at 10, where the normal level for an average middle-aged man is 0 to 4.5. So following that, he referred me to the hospital for an MRI scan, just to, check that there was nothing sinister going on. So I subsequently went for the MRI scan, and that revealed that there was some cancerous cells potentially within my prostate. So in order to confirm that, I then went for a biopsy. And the biopsy did confirm that I had low to intermediate prostate cancer, something that I would never, ever have discovered unless I had the test. As a result of that, I was given a number of choices in terms of treatment, and I ultimately chose to have my prostate removed so that it gave the best chance of getting all the cancerous cells out of my body and reduce the risk considerably of it spreading to other parts of my body. The surgery took place on the 29th of May last year. So within a few months, I'd been diagnosed and actually treated through a radical prostatectomy where my prostate was removed using robotic surgery. 8 weeks after the surgery, I was then tested again for my PSA level, and it was undetectable. And from now on, I will then get tested regularly for the next 10 years to make sure that my PSA level remains at a very low level and no cancerous cells have spread throughout my body. So obviously, as a result of that, my wife, in encouraging me to go, literally saved my life. And that's why I'm here now, to encourage everybody who's listening to this video to actually get PSA tests done, especially if you're middle-aged, if you're over 50, where you might not have any signs of it, but where the risks are a lot higher. So my wife actually saved my life, and Cemex are giving you the opportunity here to make a difference to your life and potentially save yours. So in this email, you'll find a link that will take you to a website where you can order a home testing kit. And obviously, if you have to pay for that, when you've paid for it, Cemex will reimburse you the amount that you've paid for the kit. Like I say, I'd encourage you to do so, because as my wife saved my life, hopefully doing this, Cemex could make a big difference in changing your life going forward. Thanks for listening, and good luck.